Hey guys, my name is Akshi and today I'm going to talk about the another important topic, that is gingival enlargement. I hope that you have liked the previous video and please do not forget to like and subscribe. Okay, so now let's proceed. Um, Now first of all, the topic is gingival enlargement. Now what do you understand by gingival enlargement? The enlargement of the gingiva, the increase in the size of the gingiva is known as the gingival enlargement. Okay, then um, and it is basically caused due to the interaction of the host and many other factors. Now let's talk about the classification of the gingival enlargement. So the first classification is according to the etiology and the pathological features. So that is, first is the inflammatory enlargement. In that it comes chronic and acute gingival enlargement. Next is drug induced gingival enlargement. Third is enlargement associated with systemic diseases, under which comes the conditional enlargement, which includes pregnancy, puberty, vitamin C deficiency, plasma cell gingivitis, non-specific conditional enlargement. Now, next is systemic diseases, which are causing gingival enlargement, that is leukemia and the granulomatous disease. Neoplastic enlargement, that is the benign tumors and the malignant tumors. Next is the false enlargement. It just resembles to the true enlargement. The classification according to the location and the distribution of the gingival enlargement is localized, generalized, marginal, papillary, diffuse and discrete. Now what is localized? Means it is just confined to one or two teeth. Generalized means it is involving the entire jaw, the entire arch. Marginal means the enlargement is only confined to marginal gingiva. Papillary is the enlargement that only involves the interdental papilla. Diffuse is, it is just involving all the parts of the gingiva, that is marginal gingiva, attached gingiva, the interdental papilla. And discrete. Discrete is a sessile or an pedunculated mass, we can say. Just have a look. You can even take a picture of it. Okay, now the classification according to the degree of the gingival enlargement is divided into 4 grades, that is grade 0, grade 1, grade 2 and grade 3. Grade 0 means there is no sign of gingival enlargement. Grade 1 is the enlargement that is confined to the interdental papilla, and grade 2 is the enlargement involves both papilla as well as the marginal gingiva, and grade 3 is the enlargement covers 3/4 or more of the crown. Now let's proceed to the clinical features. Uh, what are the clinical features of the gingival enlargement? So first is the enlargement starts as a painless bead-like enlargement of involving both the facial and the lingual gingival margins and as well as the interdental papilla. Now then the marginal and the papillary enlargement, they just unite and they develop into a massive tissue that is covering most of the portion of the crown, and it also then interferes with the occlusion. Third is the lesion is mulberry shaped, pale, pink, firm, resilient with lobulated surface, unless and until it is uncomplicated with hemorrhage. Then next is hyperplasia is generalized throughout the mouth. Then there is secondary inflammation is seen. Now what is secondary inflammation? There is reddish or bluish discoloration with the tendency of the gingiva to bleed. Now let's talk about the histopathological features, which involve the changes in the epithelium as well as the connective tissue. Epithelium shows acanthosis, thin retipex, increased epithelial pearls, polymorphonuclear neutrophils in the gingival epithelium, increase in the collagen production, and in the lamina propria there will be the proliferation of the fibroblast. Now let's talk about the etiology, that is the etiopathogenesis of the gingival enlargement. So first is the role of the fibroblast. Role of the fibroblast is that there are present a very heterogeneous group of the population of fibroblast, and they are most probably the responder fibroblast, that is they respond very quickly, and these are the fibroblasts which play a very important role in etiopathogenesis of the gingival enlargement. Next is as there is a decrease in the synthesis of the matrix metalloproteinases, Similarly, directly it will cause decrease in the rate of the tissue resorption, and which indirectly leads to the tissue overgrowth. So there is gingival enlargement occurring. Role of the growth factors is there will be increase in the platelet derived growth factor, transforming growth factor, epidermal growth factor, connective tissue growth factor. Then this all will lead to increase in the bulk of the tissue, hence causing the gingival enlargement. Next is inherited disorders. There will be the genetic predisposition, any familial history, and etc. Now let's talk about the differential diagnosis. It involves the anticonvulsants, calcium channel blocker, and immunosuppressant. So this three kinds of the drugs, that is anticonvulsant, calcium channel blocker, immunosuppressant, they are the most important drugs which are causing gingival enlargement. Now how do they work? Now basically how the gingival enlargement is caused. So all these three classes of the drugs, like anticonvulsant, we can talk about phenytoin, ethosuximide, sodium valproate. In calcium channel blocker there is nifedipine, verapamil, diltiazem. In immunosuppressant there is cyclosporin. So this all of the three, they just block or they just decrease the intracellular calcium ion influx inside our body and inside the gingiva. So this may lead to the drug induced gingival enlargement. Now let's talk about anticonvulsant, that is the dilantin induced gingival hyperplasia of alveolar mucosa. It generally appears in young dentate patients. In that the gingiva will be pale, firm, coarse, and there will be presence of stippling, and it will be prominent and appearance will be normal. Enlargement of interdental papilla. Calcium channel blockers, mostly in older patients the gingival enlargement is seen. Next is immunosuppressant. Cyclosporin induced gingival enlargement is more vascularized and it is more inflamed than the dilantin induced gingival enlargement. Now let's talk about the management of the gingival enlargement. The first step and the second step. In the first step, there is the first point, oral hygiene reinforcement, that is the chlorhexidine gluconate rinses, scaling and root planing can be done. And the second is the possible drug substitution, that is 6 to 12 months gap should be there, or time period between the discontinuation of the offending drug and possible resolution of the gingival enlargement. Even azithromycin, it decreases the severity of cyclosporin induced gingival enlargement. Folic acid supplementation, it decreases the gingival overgrowth and periodic recall visits. Second step includes surgical therapies indicated, and there are two types, that is gingivectomy and periodontal flap surgery. Gingivectomy is generally done where the areas of the enlargement with no attachment loss or bone loss and good amount of keratinized tissue is present. At that time, gingivectomy will be the choice of the treatment. Then periodontal flap surgery is generally indicated in osseous defects and where is very limited keratinized tissue is present. So by this I completed gingival enlargement classification, its histopathological features, its clinical features, its etiopathogenesis, what kind of drugs are causing it, and its differential diagnosis, its management, and what are its the factors which are basically involved in causing the gingival enlargement. So it is asked as a 10-mark question in MUHS University examination in your periodontology paper. So I hope you have liked my video, and please don't forget to like, share and subscribe. Thank you.